Hi, this is Todd Huntsman, and today we're going to learn about how to set up a new patient in Vivos Aire. So the first thing that we'll do is when we get to the patient management dashboard, logged in as a Vivos integrated provider, you'll see that there's a few chips up here up top that you can navigate through, as well as an add new patient button, and then the list of patients that are that correlate to the chips up above that you can manage. So active cases are ones that are actively in treatment that haven't been resolved yet and that you're kind of managing through things. Myocorrect patients are going to be just those patients who have been enrolled in one of the two myofunctional therapy programs that Vivos offers. An action required means that there's maybe some partially created patients that haven't been set up yet completely, or there's some other actionable item related to the airway intelligence report or the RX that needs to be addressed in here. So to add a new patient, to create a new patient, we're going to come up here to the upper right hand corner and hit add new patient. And the first bit of information that we need to fill out is just some generalized patient information. So I'm going to go ahead and put in some information here, and we're going to go ahead and put in the patient's date of birth. Most of this information is going to be captured off of head and neck exam information or patient intake information. Those are going to be the two documents that we have kind of beside us as we're going in and filling out this information. The patient chief complaints, this would have been captured on either one of those documents there, and it's typically related to something to do with maybe their sleep, such as snoring or maybe OSA or stops breathing, function, maybe with their joints or their breathing or swallowing, maybe there's some pain, cosmetics. And what we want you to do is to put in some information about what the patient's chief complaints are and what they're hoping to maybe get resolved with that. So patient, snores at night and has labored breathing, wishes to sleep with spouse again. Okay, we'll put that there, and then we'll hit save and continue. So when you see the red check boxes or the red asterisks there at each one of these steps over here on the right, those are going to be required fields, meaning that a bit of information is going to be required. That information is going to be required in order to move on to the next step and to complete the patient setup process. So you can see over here that each one of these exclamation points means that there's something missing that's required out of from within each one of these sections because we haven't gotten to them yet. So on this stage here, for the patient intake information and clinical examination information, we're going to be looking primarily to capture the head and neck exam and the patient health history intake form. These are typically PDFs of a written document or maybe a printout if you use Rose Neerman software or Vivos Aire 2. These could be printouts of those documents, and they're just uploaded here. Now, what I typically like to do and what we recommend is that you actually have a complete file of all of the records that you're going to be using for this process in a single folder that's open and accessed kind of right next to your browser window here. So in this case, I've got a folder with all my images in it, my forms in it that relate to this patient, my CBCT scans, my intraoral scans, everything that I'm going to need to create this patient I've got over here. So it makes this process go a little bit easier. So there's two ways that you can upload an image to us. I'm going to primarily show you the drag and drop method throughout this training, but I'll go ahead and show you both ways with the head and neck exam and the patient health history. So to drag and drop a file over, you'll go ahead and just grab the file that you want, and you'll just drag it over the box there that you want, and it'll upload that document to you, and then it'll put the name of the document that's been uploaded right there. If you want to do the click and upload method, what you'll do is you'll click on the box, and then you'll click on the file that you want, and it'll load for a second, and then it'll upload that document right there. Everything down below here is optional for the Vivos integrated provider to indicate. Most of this information is captured on the head and neck exam. The significance of this is covered in other provider training sessions, so I won't go through it. But I just wanted to highlight a couple things here, particularly on the BMI. If you come in and you type in the height here and the weight, it will calculate the BMI for the Vivos integrated provider there, just to double check on the head and neck exam. And then you'll come down here and maybe select a few things that relate to their health history, their dental history. Maybe they were prescribed CPAP and intolerant. Maybe they're allergic to some latex and some plastics. All of this is going to be relevant there. And then if you've got any questionnaires, you can come in and upload those, but these aren't required necessarily for you to move on to the next step and to set up a patient with Vivos Aire. It's more having all of the information in one place where you can come back and reference down the road as the patient progresses. So the next step that we're going to have here is the extraoral files, and you can see the 4 out of the 6, actually 7 files that you can upload at this stage. There's going to be 4 that are going to be required in order to remove the exclamation point over here. It's the big smile extraoral file, the frontal relax file, the profile facing the right, and then the submental vertex there. And additionally, if you've got some full body posture photos of the anterior and profile facing right, those are nice to have but not have to have. So I'll go ahead and I'm just going to show you here. I'm going to be uploading some of these over here on the right, and we're going to be doing that. And I'm going to go ahead, since I've got them right here, I'm going to go ahead and put in the full body postures here that I took of my patient, and we're going to put them in right there. And then if you have a 3D facial scan STL file, sometimes some providers will upload those to us in lieu of these, where we can take 3D measurements on our faciometric workups that we do for the airway intelligence report. You can export those and upload them right here to us as well. So I don't have that file, so I'm just going to go ahead and save and continue. Then we're in the intraoral imaging section. So there's 6 file options here to be uploaded. All of them are going to be required. So we're going to grab our intraoral occlusion file, our left buccal occlusion file, our our right occlusion file. We've got our upper arch and our lower arch, and these are the files that are going to be used in the airway intelligence report as well. So we've got all of those files there and look good and ready to go. We've got the check, the exclamation point has been removed over there, so we know this step is ready. Now we're on to the CBCT scan. So for more information about what's required for a comprehensive AI report, or what's the required for a Susuni Plus analysis, or how we do CBCT scan stitching, we have some training modules in the new provider training section for Block 1 that cover this. But I did want to note here some of the logic around what files are required or recommended based on patient age. So this is the stage in which we upload a CBCT scan, and if in this case the patient's 42 years old, 2 months, 8 years and older, a CBCT file is going to be required. If the patient is between the ages of 6 and 7 years of age, a CBCT is recommended. But if a CBCT is not possible, then a 2D pano and lateral ceph is required. So if you have a traditional looking 2D pan like this and a lateral ceph, there will be options here for you to drag and drop or click and upload those files if you don't have a CBCT scan for that patient. And then for our little people who are 5 years of age and younger, maybe they can't sit still during the scan, or for whatever reason, a CBCT or 2D pano and lateral ceph is recommended, but neither are going to be required at this stage. So the other thing I wanted to note is you can drag and drop the CBCT file over here, or you can click on the button to upload the scan. Most scans that are zipped are at least 100 megabytes. Some scans get up into the terabytes, so we really encourage you, if you're on a dial-up speed internet connection, we really encourage you to bump that up and try to get up to at least 25, maybe 50 megabytes upload speed, not download speed. That'll really help this process go a little bit smoother here. So for this example, I've got a CBCT scan. It's about 110 to 116 megabytes, and you can see it's uploading there. And now I see the name of my file and the file size. I know that's right, so we're going to go ahead and save and continue here. For the brand of machine that was used, usually this will save from the previous patient that was created. So in this case, we have a care stream, and the field of view size for this image, the height and width, 16 centimeters by about 15 centimeters is how we measure that out. Usually this information, it is required the first time that you set this up, but once you set it up once, it should carry over from patient to patient. Okay, so what's next is going to be the patient occlusion. So this is where we're going to get our models and information about the teeth charting as well. So what we're going to go ahead and do is just go ahead and classify the molar relationships there. We want to know who the person was that took the photos or the impressions. And this is helpful on the lab side of things as we try to go back and resolve issues on what could have gone wrong with the impressions, or this is helpful in knowing who did that, and we can talk to that person. Now, once we get through the molar relationships, there's a requirement here for one or the other or both. The 3D digital impression file. So if you have a digital intraoral scanner, you'll probably use this most often. If you don't have a 2D scanner, you might most likely use this option down here. You do not have to, but it's one or the other. So if you have a 3D digital impression files, what you'll go ahead and do is you want to make sure that you're exporting these out as STL files and not the proprietary intraoral scanner files. So for example, 3Shape has a file type called .3sz. If you are trying to upload a file like that into this section here, not only can we not use it for the airway intelligence report, but when you send these models into the lab to get printed and fabricated, that file type won't work for them as well. They've got to have the STL files here. So same process if you've got your upper scan and your lower scan, you'll just drag and drop those over here. And then we don't need the natural byte, but we do need the construction byte. This is particularly important for the mRNA and mmRNA devices. We cover this in a separate training section, and for more information about that, check that out. And then what brand of machine did you use for that? We have a 3Shape in our office, so we're going to go ahead and do that. If you upload the 3D impression files, you'll notice that there's a requirement for the upper arch and lower arch, but not the construction byte. Some 3D intraoral scanners will embed the construction byte into the upper arch or lower arch files. For more information about that, check with the help desk or with the manufacturer of your 3Shape machine or your 3D digital impression machine. If you don't have a 3D intraoral scanner, you'll just take photos of your study models and you'll upload them over here into Vivos Aire. So drag and drop method, you'll do the kind of same orientations as some of the intraoral photos. You'll just drag and drop those over here, and that can be used in place of the 3D files. And then what we always ask you to do, especially for the lab, this is incredibly important, is making sure that you come in and you indicate which the teeth charting here. And you do this before each step, and then you go ahead and check that box. That's a required step in order to remove the exclamation point here, is making sure that the teeth charting indications noted here for this patient are correct. So if you've got any crowns or bridges or implants or anything that you might want to note here, just make sure that that's correct. That's going to be really important. This information gets sent over to the labs as well. When they're manufacturing the devices, it's going to be really important to make sure that this is all correct. And then you can kind of see here what all the different indications are. We've got these ones missing back here, a couple of implants back there, so you can double check that and make sure. And then once all of those fields are correct, now you're ready to save and continue and move on to the next section. So for this, at this stage, we're going to be looking at the sleep test. So typically people will only bypass the sleep test if the patient signed a waiver refusing to take the HST, the patient's chief concerns were cosmetic only, or for some other reason, you'll come in here and select that. Or you'll go ahead and upload the sleep test for us. So the process is the same as everything else that we've gone through already. You'll come over here, drag and drop the actual file. You'll come in here and select what type of sleep test was it, the date of the sleep test, and then what stage was this sleep test at. What we would recommend, and both from a validity standpoint and from a just understanding what your treatment's going to be standpoint, we recommend that the sleep test be older than no more than about 2 years. So if it's a pre-treatment, in this case I'm creating a new patient, so it would be, we'll set the treatment stage to pre-treatment, and then we'll pull off some of the information from that. So I know that the patient had an HI of maybe 42 with the desaturation rate of about 3%. That's typically the standard, but check your sleep test device and report for knowing what the desaturation rate is for that. That'll correlate to the numbers that are produced over here. On the Vivos score by sleep image sleep test, they actually provide both of those. We recommend that you populate the 3% information on that. Then you'll just log in approximately how many hours and minutes they slept, and then indicating whether or not this sleep test was read by a qualified sleep physician. Was there a diagnosis? If there was, then what was it? Typically obstructive sleep apnea, maybe though also, and or upper airway resistance syndrome, central sleep apnea, or something else. So those are going to be the requirements for this stage here. Then we'll save and continue. And then this gives you a chance, if you have any other pieces of records or information or relevant files that for some reason we didn't capture somewhere up above that relates to this initial appointment, you can come in and upload these records here by clicking on this. It'll bring up either on a Mac a Finder window, or on a Windows Explorer. You'll just come in and be able to select those and add those in here, and it'll give you the file name here, and you can change that file, or you can upload up to 10 files, each file being about 50 megabytes max. So some providers may do a little video of their patient and upload here. If it gets too big, it may not accept that file. So now we'll, once we've done all that, all of my exclamation points are done. We'll go ahead and save and create the patient. And now it's going to ask me, okay, you've gotten all this information in. We're ready for an airway intelligence report. Let's make some selections regarding that airway intelligence report here. We'll give it a minute here. And I'm on a testing site here, so this may take just a minute. Okay, so the next screen that we're going to come up to is going to be, so we're going to get the standard airway intelligence report. If you'd like a specialist, a radiologist to read the CBCT data here, we work with beam readers on this. You'll go ahead and we can do that for a fee. That's kind of a direct pass-through from beam readers on that front. If you'd like the 3D printed airways, so out of the CBCT scan, we can capture the airway. You can print those out and give them to your patient. If you'd like that done, you would select that right there. If you'd like a Sassoon analysis to be included with the airway intelligence report, you'd click on that right there. And if you'd like the frontal analysis report, as we've gone through in some of the other training modules, you'd click that right there. So for the purposes of this, I'm going to go ahead and move forward here. Let's see. And then it should prompt up and give me a chance to put in some notes here to the technician. So this is where if you've got any notes for the imaging technicians on, hey, I've got multiple scans here, or can you take a look at maybe some incidental findings or some things like that. This is where you'll come in and type in the notes, and then you'll hit submit and you'll be ready to go. And that's how you create your patients in Vivos Aire as of May 9th, 2022. thanks for watching, and best of luck.